Welcome to Navigating Hope, your compass to health empowerment. I'm Dr. Jamie Hope, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. Okay, everybody, welcome back to another exciting episode. I cannot tell you how excited I am to have a fellow emergency medicine physician sister here who has some amazing qualifications even outside emergency medicine. So here we have Dr. Heather Hinshelwood, who goes by Dr. H for her patients. She's the owner and chief medical officer of the Fraum Center on Hilton Head Island, which I'm very excited to visit. She leverages advanced technologies, including stem cells and peptides, along with cutting-edge medical devices such as medical lasers, computer-modeled spinal decompression to maximize recovery from orthopedic injuries. Her approach integrates guided active recovery to address both the physical and psychological impacts of debilitating conditions. Many of Dr. H's patients are retirees who moved to Hilton Head Island to enjoy their golden years, only to face limitations due to orthopedic issues. So with extensive experience in media and a commitment to impactful healthcare communication, Dr. H ensures her insights provide profound benefits to her audience. I always love reading people's bios, but most exciting, thank you so much for being here to share this important work with us.
Absolutely. I'm super excited. And again, fellow ER sister, talk about lining up here. So
yes, so let's talk about your journey. So you are board certified in emergency medicine, you practice emergency medicine. And tell me about the history. So what you're seeing in EM and how did that guide you to want to take all these additional trainings and courses so you could do more?
Absolutely. I actually took a scholarship to the US Navy when I was a medical student. And so we were in the middle of two wars, and they actually sent me to a civilian training program, the University of Florida in Jacksonville, so that they had enough emergency medicine physicians for the wars. And that is me taking care of a young, healthy population. No big deal.
Oh, yeah.
So lots of fun, wonderful years. I was overseas in Okinawa for two of them. I deployed to Afghanistan in 2009. During that time, ended up in California. And then after that, ended up in South Carolina. Everybody knows Hilton Head as a vacation destination, and it is. But what a lot of people don't realize is how very, very rural it is here. So Charleston, 2 hours away, yep, big city. Savannah's a moderately sized city. And we're only 45 minutes from Savannah, but it's 20 minutes and I'm in the country. And what this means is this is a very small community. So prior to moving here, I was working in big cities. I was working in the military. These were patients I did not see repeatedly just because of where I was. So I get here and 5 years into it, I know all my patients and I'm watching people I know slowly die.
Oh, that is a terrible feeling.
It sucks. And it's not why any of us got into medicine, right? And I was really at a point in my career where I just thought, boy, I don't know that I have very much to offer patients. What I'm doing is not moving the needle. I'm not making them healthier. I'm just delaying the inevitable with Band-Aids and not good Band-Aids. And I was at a point where I was actually contemplating a career switch into hospice care because that was like the one area of medicine where I was like, I've got something for that. I can make that transition easier, no problem. Well, in the middle of that, I was also trying to find a way to stay home with my two small children a little bit more. And I responded to an ad asking for a physician to work part-time doing injections. And I was like, well, it's just over the bridge from my house. And I'm an ER doctor. I can put a needle anywhere, no problem.
We do not scare easily. So
now I'm like, this is the most relaxing thing I'll do all week long. It's fine. And so it was actually, it ended up being the clinic that I own now, but at the time is the Fraum Center, which started out as a chiropractic clinic. But Brad Fraum, who is the founder, he had a bad back, and he, like, the traditional chiropractic care was not aiding that. So he had started looking at stem cell therapies and needed a physician, obviously, to carry those out in the clinic. And I didn't know anything about it. I was like, well, fine, I'll do it because it's right near my house. I can do technically I'm fine with that. I thought I'd maybe make people feel better. I didn't really know. I thought it'd be like steroid injections. And holy cow, my first month, I am watching my patients have these debilitating and horribly limiting joint injuries that were completely reversing themselves in days.
wow.
And that was the first time in years that I felt like I was actually making a difference and making people better. And 7 years down the line, Dr. Fromm retired. My fiance and I purchased the clinic from him last year. And we've been doing this for so long that we know all the little things that are going to make patients better, right? Because there's never just one thing going wrong. There's always a lot of things going wrong when somebody
Yes.
has some debilitating injury. And so we have a whole protocol that we do with our patients that encompasses nutrition, physical therapy, ongoing care, medical grade laser, all the things, so that, yes, we're doing these human cellular tissue product injections, but we want them to get the best benefit out of it as possible. And also looking at the underlying issues, obviously, unfortunately, obesity being a huge driver right now of a lot of joint issues, joint and spine.
It is. So I love that you were in the emergency department. There are definite limitations to what can be done there. It's sick care. We're trying to put people back together. And so you started this new modality. We realize it's not a magic wand, right? You don't just give it to everyone and they anti-age a million years. And so they need this comprehensive view. And so looking at your history and what I love, in addition to being a doctor and specializing in all these things, you've got your military background, you're a CrossFit instructor. And I love how you said it's our job to influence those around us, right? We're the sum of the 5 people we hang around most. So walk me through what it looks like, this comprehensive approach that you have to really move that needle and make people's lives better.
Okay. Well, the first thing is sitting down with a one-on-one consultation with me. What is very different about this clinic is that my minimum appointment time for new patients is 30 minutes.
Wow.
Sometimes can go as long as 90 minutes. So this is unadulterated attention from a physician that most of us will never have in our lives.
Yeah, the system just doesn't support that anymore.
Yeah. And so what it does is it gives me an opportunity to take a hard look at the patient, make sure I agree with whatever diagnosis they carry. And there's a lot of times I may not. Take a look and see, what do I have to offer them that can make this issue better? And sometimes it's a human cellular tissue product. Sometimes it's medically guided weight loss. Sometimes it is an antidepressant. Just whatever it is, there's something else going on here that's leading to this thing that has the patient's full attention.
I love that it's not a one size fits all, because that's how you know that it's real. You have to talk to the patient first, see
Yes.
what's going on before you make a recommendation. And that's why I was drawn to your clinical practice in particular.
Yeah. Yeah. And there's no 2 patients that are alike. I could have a room full of 20 knee patients, and every one of them is going to need something different. Every last one of them. We also get a lot of very medically complex patients, blood thinners. Everybody's got AFib or something these days on Eliquis. They've got bad knees, and the choice is knee replacement, where you're going to have to stop the Eliquis, putting yourself at risk for a stroke or another blood clot. Or maybe you don't have to stop the Eliquis and you don't put yourself at any of those operative risks, and you get an injection with a human cellular tissue product to continue some additional care and really turn it around that way. So it's a very safe option for everybody, but the return on investment there is the biggest with our medically complex and fragile patients that we care for.
Nice, because you're preventing them from going through more complicated procedures,
Yes.
more expense, risk, and all of those things. I love in our pre-conversation before we hit the record button. I need to start recording those because they're always so amazing. We talk about how, everybody loves the most expensive and the newfangled, blah, blah, blah. And I love that you're like, no, that's not always what's best. Tell us about that.
Give me an hour in an ER and I can spend $1 million.
Oh yeah, easily. Check.
And after that $1 million, those patients are probably not going to be where they would hope they would be for $1 million, right? So we have really gotten away from the basics. A couple examples, COVID for one. COVID really brought home to roost our worst decisions as a population. And unfortunately, I thought for sure we'd learn our lessons off of that. We haven't. So things like systemic obesity, nobody going outside, everybody being in closed circuit air conditioning systems, nobody getting enough vitamin D, nobody exercising. Those people that were fit that category were the most at risk, not just for contracting it, but dying of it. And I thought for sure this will get our attention. No, it hasn't. But that's the reality is ventilators aren't going to move anybody where they want to be with COVID. These big immune modulators not doing the trick. But if you just go outside and get some exercise and not be in the AC all day long, that's a whole different story. But that is not a big expensive drug that's going to make a lot of money. So there's nobody lining up to do a randomized controlled trial about how people do with these more basic interventions.
Amen. I mean, really, that's our biggest problem with medicine. If I could highlight anything, it's that. And so when you hear a trusted physician saying, here are some interventions that you can do in your real life that don't cost money, it doesn't benefit you directly cost wise to tell these things to people, but you know that this is the best and your patients are going to have the best outcomes if they do this.
Yeah. And the reality is, like, I didn't go into emergency medicine because I wanted to have a full emergency department all the time. I wanted to go into emergency medicine just to fix the people who need it. And if we could get to the point where very few people require fixing, that's amazing.
Yes.
But, we're not there. But I also found myself having the preventative medicine conversation. Somebody just had a stroke who's about to fly out for a thrombectomy. I'm saying, dude, you are young. You've got to stop smoking and you've got to lose some weight. I don't have enough medications or interventions in the world to fix you if you don't make some changes to your life. I can give you pills, but I can't do these things for you. Yeah. And realizing how much time I was spending having those conversations with my patients and trying to impress upon them the importance of those things. That's really what I've spent a good amount of time on this part of my practice doing. Another example, we had a young guy come in, like younger than me, who became a quadriplegic all of a sudden one day. Atraumatic, no idea. They MRI'd him from his brain to his tailbone. No lesions, nothing demyelinating. I asked him, I said, did they think you were kind of full of it? Did they think you were faking? And he said, yeah, everybody thought I was faking. And I'll be honest, I was concerned he was. So I would watch him walk around my clinic because by the time I saw him, he was starting to recover. But I would watch him when he didn't know I was watching him. And when he had his arms at rest, he'd do that weird thing that spine patients do. He could use his hands, but when he wasn't using his hands, they went right back there.
Kind of curling right in.
Yeah, and he did that big Jacksonian march to get his feet off the floor.
Yep.
And so I was going through his whole record, his whole hospitalization. And I was like, B vitamin deficiency, dear Jesus.
Right.
And I was like, surely they had to have tested this somewhere. And even at one point in one of the hospitalist records, they said, consider B vitamin deficiency. Did anybody ever check any B vitamin levels or give him any? No, nobody ever did. Like, you've got a 30-something-year-old who's a quadriplegic for no reason, and you're not checking B vitamin levels. And we know that our brain and nerves will not function correctly without adequate levels of B vitamins, and they just didn't do it.
Wow.
I think that guy got immune globulin. How much is that per dose, right?
Oh, Lord. I don't even know the cost of that, but I know it's not cheap.
Right. And so I'm also being in emergency medicine, I'm a kitchen sink person. So if we're going to go big, throw all the things at them. And so when I saw him, I did feel, obviously, I felt an urgency because a 30-year-old should not have that kind of disability, right?
Right.
And I didn't wait to check vitamin levels because some of my vitamin levels I can't get back for 10 to 14 days. So I just started loading him with B vitamins. We started the human cellular tissue products, and he improved within 48 hours. And by the time he left our clinic, at rest, his hands were normal. He was walking normally. He no longer needed a cane or anything to walk. But we've forgotten those basics, like our brains can't function without B vitamins.
Yes.
You know,
Yeah. These aren't magic wands. These aren't snake oils. This is science.
right.
But we get so excited about all the latest contraptions, we forget that those like sleep, nutrition, exercise, vitamin levels.
Yep, absolutely.
Wow.
So I really think, we as a community need to get back to that. Nobody's going to bring us back to that other than us. We're not going to have big pharma encouraging us to look at vitamins.
Definitely not.
Does not make them money. That does not drive up their shareholders' stake in the company or whatever. Just it's on us, really.
Right. So you have your population, you've got a lot of retirees there. They want to have that quality of life. They're living a great life. They want to enjoy what they have left, time with the grandkids and things like that. So what kind of modalities do you have available for people that say, I'd love to go walk on the beach with my grandkids, but oh, my knee, my back, my this, my that, all of the above?
Yeah, we have a number of things, and that is something incredibly common that we hear here. After living all over the world, I chose to stay on Hilton Head. I don't know. Have you ever been here, Jamie?
No, that is on my list. I need to come visit.
You got to come and let me know when you come. I'll hook you
I
up.
want to visit you.
Yes.
This will be great.
Dude, little background on the Low Country. Number one, there's so much history here. The amount of history is unbelievable. Like all the Underground Railroad sites here, like all the battles that have been fought in this area. And then the people here are just so lovely. And we call it the Low Country, which really encompasses a whole lot. That's everything from Savannah up past Charleston and in towards inland, towards more of like before you get to the Midlands, before it starts going into the hills. But I live in Bluffton, which is just over the bridge from Hilton Head. I have a golf cart. I take my kids to school on the golf cart.
Oh man, that is awesome.
I know. I'm so upset. I got a new crab trap yesterday. I haven't had a chance to put it in the water, but we're like, we want crabs for dinner. And then we just go drop our crab trap and come back a couple hours later. It's great. So,
oh no, okay, I'm definitely coming. I take my kids to school in a snowplow. It sounds terrible.
Well, that's honestly how I picked my residency, because I was like, I know I'm going to have to be at the hospital like 4 o'clock in the morning. And I'm a Florida girl, and I'm not going to be digging my car out of snow to get there. And so I ended up in Jacksonville. And so I'd go sleep on the beach. I was just, yeah.
Yeah, that sounds amazing. I'm in summertime now while we're recording this, so I'm feeling it. But man, in the winter, and it's gray here. I'm in the Midwest, a little bit north. I get depressed. We get vitamin D deficient. You have to have your full spectrum lamp. You take your vitamin D, get your sleep, get out, get active. And I feel the difference if I don't do these basic things.
Yeah. And being from Florida, like, when did I ever have an opportunity to experience seasonal affective disorder, right? But when I was in Okinawa is very tropical. It's kind of like the Puerto Rico of Japan.
Nice.
But in winter, days are shorter, and we were understaffed, and so I was working a ton. And there's rainy, drizzly during the winter time, and days are shorter. And just because of the way the shifts worked, whether I was on days or nights, it didn't matter. I wasn't seeing sunlight. And oh boy, and I started going to the tanning bed because that was all I had. And it wasn't like I wasn't trying to get tan. I was like 3 minutes twice a week or something. But even that was just the difference between this low grade depression I couldn't shake and oh my gosh, I feel so much better.
I wonder how often, and I want to hear your thoughts on this, something like a low grade depression. I'm not talking the deep clinical depression, but more of a low grade. How much of that do you think is more from lifestyle that could be treated without huge things and a bunch of side effects?
A lot. Somebody has a really terrible diet with a lot of processed foods that will make you feel terrible, and you don't even know it until you make a change. And then like have a big old processed meal and you're like, oh, I don't feel good. This does not feel good. So
Yeah.
processed meals, sodas, alcohol is a depressant. People need to consider cutting that out periodically. See other things, that lack of exercise. I will tell you, for a very long time, after being in emergency medicine for over 20 years and being in a war zone for 9 months where I saw some horrible things, like I've got some pretty banging PTSD, anxiety stuff. And for a very long time, I was successful at treating it just with exercise. And
Nice.
that's what got me into CrossFit, honestly, because boy, if I'm worried about something, if I'm anxious about something, if I'm upset about something, if I can go throw some heavy weight around, oh my gosh, I feel so much better afterwards. So lack of exercise can really heavily contribute. And something that we're talking about more and more, honestly, are the perimenopause and menopause years contributing to a depression that we are inappropriately treating, instead of giving women appropriate HRT that has been shown to have just long life-changing benefits long term, just throwing them on SSRIs instead of looking at the hormones.
And I find that so fascinating because the data for these SSRIs, these selective serotonin reuptake inhibitors, the common antidepressants, Prozac, Pax, what have you, the data on that is not stellar in terms of giving patients recovery, which I find fascinating. But the data, the actual science behind appropriate hormone replacement therapy, not only shows improved mood and sexual function, but decreasing your risk for fractures, diabetes, stroke. So when you look at the evidence of one versus the other, it's not even close.
No, it's like night and day. And the other thing I find so concerning is the benefit it's shown at preventing dementia in women. I will tell you, looking back, when I started my training, HRT was still the standard of care. And then the WHI study came out, and it was like, just cut off everything. And so right now, my 70-year-old patients are the ones who either did not get HRT or whose HRT was interrupted by that. I didn't used to have 70-year-old women whose bodies were fully intact with dementia, but I do now. I have a lot of them. And so we are really, unfortunately, looking at a generation of aging women that were done no favors by the way that data was interpreted. And we really
Misinterpreted. You're absolutely right.
Yeah. And so we really need to get back to that. And unfortunately, I think women are really going to have to advocate for this for themselves. I'm 45. I believe strongly, like the Galveston diet, Mary Claire Haver. Have you read her stuff?
I don't. Give us a quick synopsis of that. I need to look into this. Tell me more.
Oh, she's awesome. And actually yesterday she was on, what's that one podcast? The Huberman Lab podcast, with him. And so that would be a great one. And also follow her on TikTok. I love her TikToks because it's like 2 minutes of this super bite-sized stuff. But she's a board certified OBGYN, and her whole thing is exactly what we've been talking about: appropriate HRT, the benefits of it, doing what we can with diet and exercise based on where we are in our lives to maximize our long-term health. That's what we need to be doing. And she's just so good. And all her stuff is just spot on. And it really is just, it's common sense. And it's everything we've been talking about: the vitamins, the exercise, the nutrition, the sunlight, HRT. So that we are going to have to advocate for ourselves with that. I am 45, but that my anxiety symptoms and were not being well controlled on the things I've done for a very long time and been fine with. I was starting to get kind of labile moods that I was I was spending a lot of time working on. And I thought to myself, oh, I wonder what this is.
Right? Huh, weird.
I mean, my college roommate already has a frozen shoulder. And
Lord.
I was like, Mel, you got to get on some HRT. And she was like, well, I'm going to wait. I was like, you've got a frozen shoulder. What else are we waiting for?
Right. Wait for what? What's I love people are like, I'm just going to wait until it's harder. Until
it's worse, till the other one's frozen, until you can't lift your arms. What are we going to do here? And so she went in and got HRT. And so I went to my doctor, who I adore. He's a smart dude, good man. And I told him I wanted HRT. And he proceeds to pull out the most toxic forms of those hormones.
Oh, no, no, no. Yeah.
Yeah. And I was like, Brad, dude, no. I was like, he was like, Heather, this is all I know to write. I was like, fair enough. And I was like, please go read the Galveston diet for starters. And this is what I want. I want estradiol and microionized progesterone. And I've been on that for about 3 months now, and all that extra anxiety, the mood swings that I was having trouble containing, gone. They're fine.
Nice.
I'm good.
And I love how this whole conversation is focused on supporting your body's function, just improving. So I feel like garbage. If I eat processed food, like a big meal going out, it's not even fun. People are like, oh, are you on a diet? No, I just don't want to feel like trash tomorrow.
Yeah, exactly. And the other thing that is just so important with this, honestly, is us remembering how smart our bodies are.
Yes.
Because in our training, we're taught that like we're the great white knights riding in to save the day from our diseased bodies. We're the heroes.
Right.
And that is just not the case. We talk about this at my clinic. We call the clinic the Center for Restorative Health, because that idea of restorative, restoration, to return to its previous state. Our bodies knew how to go from 2 half cells to a whole heart in 3.5 weeks. Our bodies built a heart in 3.5 weeks. We would do well to remember that and see what we can do to harness that and try to build on that and encourage that recuperative power, not just decide we got to cut it out and just start chopping away. So
yeah, punish, poke, prod, fight your body. Let's work with it.
Yeah, exactly. During our lifetimes, our native stem cell population starts to decline in our 30s.
Mm-hmm.
And what we do have that we have left goes to sleep. And so by the time we're 80, we have a few hundred stem cells in our whole bodies. And stem cells are responsible for directing repairs. So when we have a body with few stem cells, the ones we have are asleep, like we're not going to be able to heal a whole lot. And that really is the next phase of medical research and biotechnology, is figuring out how to reactivate our native stem cells, how to get that population back up, and how to get it directing repairs again.
So let's talk about that. So unfortunately, there is some controversy even associated with the word stem cells. And I think a lot of that comes from misunderstanding of the source of what it is. Stem cells exist in us. It's what created us. So can you give us just a quick primer? Yeah. What is a stem cell, so we know how we can utilize this as a technology?
Absolutely. So stem cells are undifferentiated cells that are capable of turning into any different type of tissue. They also play roles in telling cells not to die. When you've got a stroke, if we can control the cell death around the injured tissue, that really limits the severity of the stroke, right? It also it's inflammation, because what inflammation is an SOS signal, right?
Yes.
It's saying, hey, I tore this meniscus is torn. I need to fix it. Help me, help me, help me. And it's sending up these inflammatory markers, trying to attract those stem cells to the area to start the repairs. Okay. So I've been doing this long enough. I've gotten quite the front seat to the regulatory history of the stem cell.
Go ahead. Give us the skinny on that.
Well, it has been the Wild West for sure. And it does not need to be the Wild West. And so we've been experiencing big swings in the regulatory environment regarding stem cells. So initially they were not well regulated. There are some very public bad actors.
It's the problem right there.
Livion would be, if anybody knows the history, Livion is the big one everybody thinks of. I have some experience with them too. Very interesting. And yeah, but the thing is, everybody can see this promise, right? They can see the power in it. And it attracted some people who were fly-by-night, pop-a-tent, snake oil salesmen.
Absolutely.
It doesn't change the fact that the science is there and the efficacy is there and the power is there. So in response to those bad actors, the FDA came in and started laying down the law, which they needed to. The trouble is, and this is something a lot of people get caught up on, the FDA, Food and Drug Administration, okay? Stem cells are neither a food nor a drug. They are a cellular tissue. There is a section of the FDA that is trying to jam stem cell products into the drug category, and that is not what they are. And so people like to use that phrase like, it's not FDA approved. Well, there are lots of things that we do that aren't FDA approved. They're not meant to be FDA approved.
Yeah, neither is drinking enough water every day. And
right. Looking both ways before we cross the street. That's not FDA approved either, yet we know it's the right thing to do.
They have approved a few things that are a little questionable. So they're not perfect.
Right. They're not perfect, but they're trying to settle the regulatory space out. That being said, I don't think we can ignore how much money Big Pharma sends to the FDA.
Right.
Because so you got one, let's say a knee replacement in the US costs about $80,000.
Right.
That's if everything goes well.
Yes.
Okay. So that's $80,000 to hospitals, to the manufacturers of the products, anesthesiologists, the surgeons, the nursing homes, physical therapists, rehab, like I can keep going, all the people.
Oh, yeah.
So if we start to recognize that human cellular tissue products have the efficacy and the power to replace joint replacements in some patients, that's $80,000 that's gone.
Right.
Those big interests that have easy access to the FDA, who are already giving the FDA and their lobbyists a lot of money. And so we're also not playing on an even playing field here, right? We're not looking at these options with an untarnished view. So that's another thing. So right now, in response to the bad actors, and I think also with the outside interests nudging things along, the FDA really swung too far the other way. And they started saying things like, you can't even say the words stem cells, which it's a scientific term. What do you mean I can't use those words?
I mean, so I love the nonsense rules. You're like, what?
Yeah, regenerative medicine, like that became their new verboten thing. Like what? And
Lord.
So just silliness and shenanigans. Well, what's happening right now is, number one, the veteran population is moving this issue along, okay? Which the veteran population, I think, is what's going to get stem cells into a mainstay therapy, because most of us are young and fairly healthy. And it is a terrible idea to give a 30-year-old a knee replacement, right? That is not even appropriate. But after they've been carrying 80 pounds of gear for the last 8 years, they're going to need something. So we really have the veteran community pushing this along. And there's actually some good legislation coming through seeking to get the FDA to stop pushing stem cells through the drug pathway, because that's not where they belong.
Right, I agree.
So the veterans are going to really help move the needle there. The other part of that is that there have been some big cases recently where the FDA has been challenged in court about this, specifically regarding autologous stem cells. Like if you take somebody's bone marrow and reintroduce it into another space in their body.
So we're not even talking about harvesting stem cells from anywhere else. You're literally taking it out of one part of your own body and sticking it in another part of your own body. I don't know where the controversy is.
Right. Well, the FDA had something to say about it, and there have been some lawsuits, and the judges have come back and said, no, you can't just say no to everything. And that's their body tissue. Like you don't get to weigh in on it to this extent. So they're being forced from multiple directions to start reconciling this and having a more thoughtful approach to how they regulate it. That being said, one thing you're hearing a lot of right now is saying, but you have to go to Mexico or Panama or Costa Rica to get stem cells. And I had a good friend who became a good patient who had a lot of back, knee, and ankle issues from his lifetime of golfing. He is an avid golfer, which is something we see a lot around here. And I had him all excited about care, and he called me and he was like, he was freaking out because his buddy in Tennessee had sent him this big article or this like long email in begging him not to get stem cells on Hilton Head because obviously like all these fallacies about him. And I was reading through the email with my friend and I was like, no, this isn't true. This isn't true. This isn't true.
Yeah.
And I said, as much as we may be frustrated with the FDA about how they've approached the regulation of the stem cell industry, what I do want is the FDA regulation of tissue products when I am looking at a tissue product for myself.
Right. Absolutely. Right. You want it to be safe. You want it to be what it says it is. Those are all good things.
Right. You want it to be appropriately tested, just like you would want a heart transplant or a blood transfusion to be tested. We want all those things. And I don't have the blind faith in those other countries that will in fact be the case. And the reality is there's no reason to leave the continental United States for that kind of care because we do have those capabilities here in the United States. And there are some really good labs making some amazing products. And I'm not the only clinic like this, but I will tell you, I don't know of another clinic that does it the way we do it.
Nice.
So a lot of clinics that offer human cellular tissue products are not physician-led. They are more driven by mid-levels or paramedical professionals like chiropractors. And that's not what happens here. I'm here 5 days a week. I'm the one who owns this clinic.
You're seeing a board certified MD.
Yes.
For these. And I really do think that's key. Because there are a lot of bad actors out there, the red flags. Oh, this will cure everything. This will, it's magic. You don't need to eat healthier, exercise. This will just fix all your ailments and you can continue bad lifestyle choices. Like those are red flags. And somebody who doesn't have a degree.
Right.
That's so worrisome to me.
It's shocking to me. I'm from Orlando. And my mom got a letter in the mail from one of these, come to a dinner about stem cells. And she shows up and she was just like,
oh boy.
Yeah, the guy who presented, she was like, so who does the shots? And he was like, well, Dr. So-and-so. She's like, isn't Dr. So a chiropractor? Well, yeah. What? And so, you really, because we are still in the early days of the therapies with human cellular tissue products, it is still important for patients to look around for the right clinic that does, like you said, is not promising things that are unrealistic, that does have the professionals who are qualified providing the care and is there to be with patients every step of the way. That was one other thing that the FDA really came down hard on in these clinics that would set up shop in a shopping plaza and disappear the next day. And this clinic has been here on the island for over 30 years. I see my patients twice a week for a month after I do their injections. So
you don't just biopsy their wallet and then hit the road.
And even they could call me 8 months from now and say, something's wrong with my knee still. I'd be like, come on in. I'm not charging them another $500 to come, see me. It's, I already worked on you. Let's see what's going on. So,
right. That level of integrity is huge because I worry about the lack of integrity in some other places serving as a barrier to people getting access to these modalities that can help them.
Yes, absolutely. Yeah, and integrity is key. Relationships. One thing that is interesting here is you touched on the retirement population that we have. They move down here to do the golfing and the fishing and the beach. People who have worked their whole lives and then they get here and they can't golf because their shoulders hurt too bad. That's just heartbreaking to me that somebody would work so hard and then be faced with not being able to do the thing that they put off for years. Right. And that's a big part of our population, but we do also have a good chunk of our population that is not from here. So probably I would say a third of our stem cell patients are from out of the area. We coordinate their care when they go home too.
They're doing their research and coming to a place they feel comfortable, even if it involves a little bit of travel, because it's safer to get the better outcome.
Absolutely.
Yeah. Excellent. Wow. I love it. I love that you have this comprehensive approach. You see your patients through the beginning. You don't have a magic wand. You have science and logic and reality. Yes, love, like
out.
These are such lovely things. So whether you're utilizing the tissue or you're utilizing peptides, helping support exercise. I did want to do just like a brief back to exercise. I like what you said about exercise, where they're at. So you don't just tell everyone, okay, go do CrossFit if you're 73 and obese and have two bum knees. It's exercise is patient specific also. Tell me about that.
Well, let me start out by saying I do tell a good chunk of my patients to do CrossFit because there's not another place around here where you get the level of coaching and guidance that you do in CrossFit. And
nice.
Especially with my patients who have not worked out before, right? They do need that level of professionalism and that amount of guidance. I tell people, I'm not going to name gym names, but some places that I guess kick you out when you try too hard and you have a monthly membership to, they'll tell me, oh, I joined that. I'm like, you're not making me feel any better about this because I know you don't know what to do with any of those machines.
Right.
And here, like we've got two really good CrossFit gyms in our area. Right behind us, we have Coastal CrossFit. It's owned by a physical therapist. She's wonderful.
Nice.
The CrossFit I go to in Bluffton, CrossFit 843. Oh my word, talk about some amazing coaching. And if I'm telling somebody they need to exercise more, that's where I'm going to send them.
So even within CrossFit, it's personalized to your ability level. See, that's I think a lot of people just picture some hard body 20-year-old and they're like, I can't do that. That's not going to work for me. But even within that, you can find your own ability level.
Yeah. You mentioned like the 73-year-old obese patient with a bad knees. Yeah. But that's the thing about CrossFit. It's infinitely modifiable. So our workout today was like 12 sets of either 300-meter run or 300-meter row. Okay. If I had that patient, probably not going to be 300 meters, but it could be 50 meters and then the 1 minute break. Let's do that 12 times. So, meeting people where they at, but also knowing that you're going to have to challenge yourself to get through this. And one thing that we are not paying enough attention to is weight training. And we have so many terrible physical fitness and nutrition ideas left over from the 80s. It's so
Lord, right?
funny. Where do I start?
We can do a whole podcast just about debunking nonsense. Let's schedule a part 2 for real.
Oh my God, it's bonkers. I mean, it's just, it's fat free. It's in a box. Like, what? No, eat the avocado.
It doesn't rot. That's so bad.
I'd rather you have the avocado than have that, whatever that is. I don't know. Like,
right.
And the idea too that, well, if I want to lose weight, I need to do cardio. And what we do know is that if you do cardio alone, you will gain weight. And we need to run from bears or alligators, as it were, down here.
Yeah, I was going to say, in the north, we say run from bears or something like that. There's not as many alligators here chomping us through the snow.
No, there are alligators here. I will tell you, though, that in the south, we do have bears. And actually, Florida or Orlando has a really bizarre bear problem right now.
Oh, that's hilarious. They're just eating all the Disney food, like living their best life.
They're going through downtown. I'm talking near my mom's house. Like they're in the trees in the backyard. So it's kind of crazy. But,
oh my gosh.
Yeah, you do need cardio to be able to run from things, right? There's a reason for that. But we need to be able to pick up heavy things too. And my least favorite exercise in CrossFit is burpees, right? But the thing is, if you can do a burpee, you can get yourself off the ground.
Yes.
And all of us have to be able to do that. So I do send a lot of my patients to CrossFit. We have, and I think this is everywhere, a dearth of something in between doing what you've always done and going straight to CrossFit. There's actually a company here that has the capability of doing that. I'm trying to coax them into offering that because they do have those services. They just use them as part of something else. But I'm like, if I could please send these deconditioned sick patients to you to get in the pool and do the exercises with your trained team, like that would be amazing. So I am working on getting some of that around here because we do need that. People are not going to be able to just keep sitting on the couch after I give them injections. They can, but they're not going to be happy with what they get.
Yeah, we need to do the work.
Yeah, absolutely. We just have to. And so many of us have preconceived ideas about how little we can or can't do. And we let those rule us. use another one of my college roommates as an example. She comes up to here on me. She's she's had 3 kids, right? And she's an interior designer. I know she can pick up heavy things. And it was during COVID, and they had come to my house to visit, and I'm outside. This was my COVID like gift to myself, is I got I got a bar, a weight rack, and the full set of weights, because I was like,
Nice.
if I
Oh,
don't lift
love
weights
it.
through this, I'm going to lose my mind.
Absolutely.
Yeah. And so they were visiting, and I'm outside doing front squats or something, and she comes out and picks up my 5-pound weight and starts doing like a single bell deadlift with 5 pounds. I was like, what are you doing? And she was like, well, I read that it actually works better. And I was like, no, that's not how that works at all. I was like, Jen, I know you. I was like, if Janie were pitching a fit on the grocery store floor, what would you do? She's like, well, I'd pick her up and drag her out of there. Right. And she weighs 40 pounds. So maybe pick something heavier up. Okay.
Yeah. Don't be afraid to pick up heavy things, everybody. Do it safely in a way with good body mechanics, but pick up heavy things.
Yeah. I'll tell you a funny story. Nancy Mace is our US representative from this area. And just so if y'all hear some background noise, we still have patients being seen in the
She's
clinic.
coming to us live from her clinic. That's how important this is to her, because like educating people about these healthy lifestyle choices, she's actually has a full clinic day and has stepped aside. So don't mind the background noise.
Yeah. So I love Nancy Mace. The story with her is she was the first woman to graduate from the Corps of Cadets at the Citadel.
Nice.
Yeah, so she's pretty hardcore, right? And so now she's in the House of Representatives. And I went to a function of hers with my 2 sons right towards the end of COVID. And we were far and away the youngest people there. And so she came over and started talking to us. And I told her what I do. And she's like, oh, I'm estrogen dominant. What do I do about that? And I said, well, you weight lift, go to join CrossFit, get your testosterone up. And she goes, oh no, that's too hard. And I was like,
nice answer.
I didn't want to call her out, but I was like, did graduate for the first woman to graduate from the Corps of Cadets at the Citadel? I think you can handle some CrossFit.
That sounds harder to me. I've never been there, but that sounds pretty hard.
It's, if you've ever read some Pat Conroy, Lords of Discipline, it's pretty accurate. So yeah, it's pretty hardcore.
Oh, geez. That is good to know. Okay, so I know we could do this all day. This is so great. I definitely think we're going to have more conversations in the future. I see a great relationship forming here. So Dr. H, final takeaway, anything that you want patients to know that so they can feel empowered, whether they're utilizing the innovative technologies or the simple, inexpensive stuff, what is going to be something that they can do today?
Today is go to the grocery store and eat foods that don't come in a box or a bag. Okay. So steak, chicken, fish, veggies, fruits, something you have to prepare, something that used to have eyes or lived in the ground or on the ground. Okay.
Nice.
So fresh, non-processed foods, go for a walk, out in the sunshine, go for a walk, start seeking out opportunities to do things like lifting heavy weights in a safe way. When you are faced with an obvious need to go do things like that and you don't know how to do them, look around for the help and the guidance. Okay. Even if it is overwhelming, do yourself a favor and don't let the fear dictate your decisions, because the reality is usually so much different. So even if it is, boy, I do know I need to lift weight, I don't know how to do that. Don't join the gym that hits the buzzer when you try too hard. Don't do that. Go to CrossFit, because you find a community like that. Here's the thing, like the most cut, amazing athletes are going to be the ones cheering you on and high-fiving you for your hard work. Your hard work won't look like their hard work, but it's still hard work. So going out, seeking those opportunities. And the reality is, we in this country have decided that to be healthy, you need a doctor's help. And that is not true. So looking for those opportunities, things that you can do yourself, and honestly will move the needle much more than any prescription I can give somebody. Any prescription. If you're smoking, please seek the help. It's incredibly difficult to quit. You don't have to do it by yourself. There are some great tools for assistance, but things like that will make the biggest impact on your long-term health more than anything else.
Absolutely. Oh, I love it, love it, love it. I know that there are people who are listening who want to learn more about you. What is the best place for them to find you?
Yeah, check out our website. Honestly, it's fraum.com, Fraum as in Mary.com. Again, this practice has been here for 30 years. I've been employed by it for 7, and my fiance and I have owned it since September. So the clinic does not carry my name, which I am more than fine with, but we do carry a legacy of proactive healthcare and an integrated care approach. So if anybody is interested in finding out more about us, our website, fraum.com. When you call our clinic, you will talk to a person. You are not going to talk to a phone tree.
A human being? What? I
know. It's crazy. And so
right?
you will talk to a person. I can do telehealth consults. Or, hey, did you know that medical care travel is a tax deduction?
Oh, see? Very nice. So people could get the lead up stuff, a little tax deduction. Listen, I love a good tax deduction.
I got to go to Hilton Head, see my doctor. I
so
do.
sad.
The mileage, the airfare, the lodging, all that stuff within a certain bracket of income, but it is tax deductible. It's not a bad place to see a doctor.
Yeah, I was going to say, all right, I'll be there next week. All right. Well, thank you, everybody. Oh, so stick around for your final takeaways and your free gift. Dr. Hinshelwood, Dr. H, you are fantastic. You are elevating the lives of your patients. You're empowering people to restore their own health. And you have such a variety of customized tools to help people. Thank you so much for the years of dedication and training you put into this. You are truly an amazing doctor.
I appreciate it, Dr. H.O.P E. Thank you so much for having me. And I just want to, again, thank you you have the vision and you have put it on a platform so that as many people as possible can access it. So I want to thank you for doing that and providing this the way you have.
Cool. Thank you. All
right. Talk to you soon.
Thank you for joining us on this enlightening episode of the Navigating Hope podcast. Today, we had the privilege of speaking with Dr. Heather Hinshelwood, a dedicated physician, owner, and chief medical officer of the Center for Restorative Health on beautiful Hilton Head Island. Here are the 5 key takeaways from our conversation. Number 1, a comprehensive approach to health. Dr. H emphasized the importance of a holistic approach to healthcare. Rather than offering a one-size-fits-all solution, her practice tailors treatments to each patient's unique needs, ensuring comprehensive care and a plan that addresses the underlying causes of the health issue, not just the symptoms. Number 2, the power of regenerative medicine. Dr. H discussed the transformative potential of regenerative medicine, including the use of modalities such as stem cells and peptides to aid in the recovery from orthopedic injuries, or those to your joints and bones. She shared inspiring stories of patients who experienced significant improvements in their mobility and quality of life after receiving these treatments. Number 3, restoring functionality and quality of life. Many of Dr. H's patients are retirees who moved to Hilton Head Island seeking an active lifestyle, but found themselves limited by joint and back pain. Her clinic's protocols, which include some advanced therapies, help these individuals regain their functionality and enjoy those golden years to the fullest. Number 4, the importance of preventative care. Throughout the episode, she stressed the importance of preventative care and lifestyle modifications, such as regular exercise, proper nutrition, maintaining healthy vitamin levels. These simple but effective strategies can prevent many of the chronic conditions that lead to debilitating health issues later in life. And lastly, number 5, personalized care and long-term support. Unlike the rushed and impersonal experiences many patients encounter in the healthcare system, Dr. H offers personalized care with extended consultations, ensuring that she fully understands each patient's needs. Her clinic provides ongoing support, following up with patients long after their initial treatments to ensure lasting results. So those are some of the green flags. Here at Navigating Hope, we talk about red flags and green flags when it comes to a physician or a healthcare provider. Red flags being things that make you kind of worry that you would want to avoid, and green flags being behaviors that they do, such as listening to you and following up, that would make you want to go see them. So as a free gift to you, you can download your absolutely free red flag, green flag checklist. The link will be in the show notes, and you can utilize that when you are seeking out any healthcare provider for any of your healthcare needs. It's just another excellent tool on the way to navigating the healthcare system. Remember, your health journey is unique. It is never too late to start making positive changes. So stay hopeful, stay determined, and as always, keep navigating your journey with hope. Thank you for tuning into Navigating Hope with me, Dr. Jamie Hope. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating Hope. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.